I'm Dr. Maxine Jochelson. I'm the Director of Radiology at the Evelyn Lauder Breast and Imaging Center at Memorial Sloan Kettering Cancer Center. I'm a professor of radiology here, and I do primarily breast imaging with a little bit of PET-CT. The problem with male breast cancer is that it is very rare. It's 1% of all breast cancers that we see. And if you look at the world's imaging data on screening or following men who have breast cancer, you will find very little. And in part because each institution sees such a small number of men with breast cancer that it is really hard to sit down and try to publish something meaningful. So there aren't even great data as to whether to screen men who are at high risk. There are obviously men who have BRCA mutations, men who have had breast cancer, men who have had radiation therapy to their chest wall when young. All of these people, all these situations do increase their risk, but there is nothing that says when to start screening, whether to start screening. There are no data to suggest that screening improves mortality like there are in women. And the same is true for following breast cancer. So there have recently been a few studies published on the screening of men, and one of them came from this institution, the other from NYU. And we've all demonstrated that, in fact, if you screen men at increased risk, that you have the same cancer detection rate on mammography that you have in women. So we found about 4.3% cancer detection rate. And again, it's such a rare cancer that you're not going to have a very high one. And the group at NYU found similar numbers. There are no papers on whether supplemental imaging is of any value. And that by that I include ultrasound, MRI. And then after the patient has been treated, now there are a couple issues. It used to be that every man who had breast cancer had a mastectomy. So following the local disease has never been an issue, but now men get lumpectomies and radiation. And there are really no data in terms of the contralateral breast. So I find that different clinicians follow patients differently. And of interest in our study, the patients who did have breast cancer that we saw were men who had had breast cancer, not mutation carriers. And so we did find cancer. I do think it's a good idea to follow men with mammography. They are less likely to have missed cancers like as women do because men's breasts are predominantly fatty, so that you should be able to find a cancer very easily using mammography alone. In terms of following them for systemic disease, I think the rules are the same as they are for women.